Hi everyone, I'm Lauren and I'm an occupational therapy student, and today we're going to be talking about pelvic health and incontinence and ways that you can keep your pelvic floor healthy and manage symptoms of incontinence while you're here at the hospital and after you leave. Incontinence is the involuntary loss of control over urine or stool. This can range from occasional leaks to a complete loss of bowel or bladder control. Urinary incontinence is when your bladder control is affected, and there are 5 different types. And the second category of incontinence is fecal incontinence, which is also called bowel incontinence. And this can range from occasional leakage of stool or gas to complete loss of control. The first type of urinary incontinence is stress incontinence, and this is the most common type of urinary incontinence. In this type, leakage occurs due to weak pelvic floor muscles that aren't strong enough to hold back urine when pressure is applied to the bladder. So common activities that apply pressure to the bladder are coughing, sneezing, laughing, standing up, or exercising. The second type is urge incontinence, and in this type, you have a strong sudden need to urinate, and it leads to leakage before you're able to reach the toilet. The third type is overflow incontinence, and in this type, the bladder doesn't fully empty, and instead it overflows, causing urine to leak. And if you have this type of urinary incontinence, you may not feel the urge to urinate at all. The fourth type of urinary incontinence is functional incontinence. And in this type, the bladder works normally, but other challenges such as limited mobility, pain, or cognitive impairments make it difficult to get to the bathroom in time, and this leads to leakage. And then the fifth and final type of urinary incontinence is mixed incontinence. And this is where you have a combination of 2 or more types of urinary incontinence, and the typical ones are stress incontinence and urge incontinence. There are 2 main types of fecal or bowel incontinence. The first is urge. If you have this type, you'll have a sudden, strong need to have a bowel movement, but you'll be unable to reach the bathroom in time. And this type is similar to urge urinary incontinence. The second type is passive. This is where leakage occurs without you feeling the urge to have a bowel movement. Incontinence is very common among people that stay in inpatient rehabilitation facilities, like the hospital you guys are currently at. And it's estimated around 40 to 60% of patients that are at hospitals like this one will experience incontinence after their illness or injury. And some common conditions that are associated with incontinence are stroke, spinal cord injury, hip or knee replacements, brain injuries, and neurological conditions, so Parkinson's disease, multiple sclerosis, and dementia. Incontinence has a significant impact on your mental and your physical health. It can impact your quality of life, your confidence, and your ability to participate in daily activities. It also increases your risk of falling and developing urinary tract infections, skin infections, and pressure ulcers. So incontinence, although it's common, it is not a normal part of aging, and it should always be addressed. But the good news is that incontinence can be managed, and there's a lot of ways that we can manage it without medication or surgery, and these include following a consistent toileting schedule and different lifestyle modifications, which we're going to talk about. Next, we're going to talk about the pelvic floor and how it relates to incontinence and what it is and how to keep it healthy. So the pelvic floor muscles form the base of your core. They support the bladder, your bowel, and your reproductive organs. Both men and women have pelvic floor muscles. The pelvic floor can be thought of like a hammock that is a group of muscles stretching from the tailbone, which is at the back of your pelvis, to the pubic bone, which is at the front of your pelvis. Or in this picture on the left, you can think of it as a bowl-shaped base that sits inside of your pelvis. So here's another picture to kind of see what it looks like and some more functions of it. So the pelvic floor also assists with sexual function, and it works with the core muscles to stabilize your body during movements and helps the body manage pressure during coughing, sneezing, and exercise, so lifting and pushing. Just like any other muscle in your body, if your pelvic floor muscles become too tight or too weak, it can cause problems. Pregnancy and childbirth can strain or injure the pelvic floor, which can lead to problems and incontinence. And it's estimated around 50% of women over the age of 55 are affected by these problems. But men can also be affected. Also, as we age, our muscles naturally weaken, and this can lead to problems as well. We want our pelvic floor muscles to be strong and coordinated so that they contract and relax efficiently. Some common symptoms of problems with your pelvic floor are incontinence, difficulty emptying your bladder or your bowels, so this looks like urinary retention and constipation, and then pain. Pain can be in your pelvic region, your lower back, your hips, or your legs, or you might have pain during sexual activity, when you're urinating, or when having a bowel movement. If your pelvic floor muscles are weak, this means that they're underactive. This is the most common type of pelvic floor problem, and if you have this type, it makes it harder to control your bladder and your bowels, and you'll experience more frequent leakage. Also, other muscles in your body might work harder to compensate for weak pelvic muscles. Tight pelvic muscles are overactive muscles that stay tense even when you're resting. Because these muscles are constantly contracting, this leads to fatigue and weakness. And just because the muscles are constantly contracting does not mean that they're strong. They're actually weak muscles also. People with this type of pelvic floor problem have difficulty relaxing and contracting their pelvic floor. If you're experiencing signs of pelvic floor problems or incontinence, it's really important that you talk with your therapist and your doctor. We can help with assessing your symptoms, providing education and resources, recommending safe and effective strategies and exercises, and help you find pelvic floor specialists in the area if needed. There are different treatments out there, but they vary depending on if you have a weak or a tight pelvic floor. So it's really important that we figure out what's going on, because doing the wrong exercises or using the incorrect form can actually worsen your symptoms. Next, we're going to talk about lifestyle modifications for bowel, bladder, and pelvic health. While you're here at the hospital, our goal is to help you regain independence, and we focus on function. We want to encourage you to use the toilet, the bedside commode, or a urinal while you're seated on the edge of bed as much as possible over other options such as using a catheter, using a bedpan, or just using adult briefs, because these other methods are associated with higher risk of infections and skin breakdown. So we want to encourage you to use more functional options in order to preserve your dignity as a person, protect your skin, and lower your risk of infection, and also prepare you for leaving the hospital and prevent you from coming back due to a fall or an infection. One of the best ways to manage bowel and bladder incontinence is to follow a consistent bathroom schedule. And this is something that we can help you do during your stay by putting you on the bowel and bladder program. If you're placed on this program, you'll go to the bathroom on a consistent schedule, and it's typically every 2 hours during the day and every 4 hours at night if you're waking up or if you're experiencing any leakage at night. We want to do this to first help reduce leakage and improve bowel and bladder control, but also to lower your risk of falling whenever you're getting up to go to the bathroom, skin issues, and urinary tract infections. This also can help increase your independence and your quality of life. Some common risk factors of urinary tract infections include having poor hygiene practices. You want to make sure that you're always wiping from front to back to help prevent bacteria from the bowel from entering into the urinary tract. This is especially important for women because the way that our anatomy is, it makes it easier for this bacteria to travel. Also, other risk factors include having diabetes or a weakened immune system, having a recent history of urinary tract infections, recently being constipated or having loose stools, not being able to fully empty your bladder, recently experiencing menopause or having a catheter, and having an enlarged prostate if you're a male. Some more tips for healthy bowel and bladder habits. Don't go just in case. Go whenever you need to go, or follow your bathroom schedule of going every 2 hours or 4 hours. But don't go just in case when you're about to leave the house or if you're about to get in the car, because over time this can train your bladder to need to go whenever it's not full. and this can lead to you feeling like you urgently need to go or having to frequently go. Again, practice good hygiene, don't rush, fully allow your pelvic floor to relax, and don't push when you're urinating. Make sure you stay hydrated to avoid urinary tract infections and help avoid constipation. And we'll talk about in a little bit different toileting positioning that might be helpful for you. Here's some examples of equipment that your occupational therapist can use with you if you're struggling to wipe from front to back. So we have toileting tongs, and we also have a freedom wand, which can be adjusted to be shorter or longer depending on your needs. But these can help you be more independent and help you reach and wipe the proper way. If you're having difficulty emptying your bladder or your bowels, you might benefit from using a stool like a squatty potty for sitting on the toilet. The picture on the left shows how most people sit on the toilet, which is upright at a 90-degree angle. This does not allow for your pelvic floor to actually relax and is not the most efficient and effective way to sit on the toilet. The picture in the middle shows the most natural and effective way to sit on the toilet, which is a squatting position. Sitting in a squatting position can reduce straining and can help with emptying your bladder and your bowels. The picture on the far right shows how you want your body to be positioned. So you want your feet to be on the footrest, you want your knees higher than your hips, and you want to lean forward and put your elbows on your knees. You also want to check your posture and make sure your spine is straight. Talk to your occupational therapist and your physical therapist to see if this is something that would be helpful for you, and if so, they can help you practice it while you're at the hospital. What you eat and drink can impact your bowel and bladder habits. This chart shows some common bowel and bladder irritants and also some things that cause constipation. These are alcohol, coffee, dairy, smoked, processed, cured, or fried meats, spicy, salty, or acidic foods, sugar and honey, and sugar substitutes or artificial sweeteners. If you notice that your symptoms of incontinence or constipation worsen after eating these foods or drinking these drinks, you can try cutting back on how much you have each day, or try removing it from your diet for 1 to 2 weeks to see if you notice a difference. Again, always talk to your doctor or your dietitian before making any changes to your diet. Staying hydrated is important for managing incontinence and keeping your bladder and bowels healthy. Some people think that limiting your fluid intake when you have incontinence will help, but it can actually make things worse. Being hydrated helps to dilute your urine, which makes it less irritating to the bladder. It helps to soften your stool, making it easier to pass, and it helps fiber work better. The daily recommendation for water intake is at least 6 to 8 cups of water a day, and aim for 9 to 13 cups a day. Some tips for staying hydrated: start your day with a glass of water, drink water with meals, and continue drinking water throughout your day. An easy way to do this is to keep a water bottle with you, and they make tons of different kinds, different colors, some with straws, and some even have labels with times to help you stay on track of how much water you should be drinking during the day. There's different apps that you can download that will send you notifications to drink water, or you can set reminders or timers on your phone. If you're having difficulty with the taste of water or the lack of flavor, you can try to add fruit, or you could mix juice and water to have some flavor. Also, try to eat healthy foods that will give you some fluid intake. So about 1/5 of your fluid intake daily comes from food. You could try fruits, vegetables, soups, or popsicles. If you're experiencing nighttime leakage or getting up multiple times to use the bathroom, here's a few tips that you can try. First, you want to make sure that you're drinking enough water throughout the day and don't try to catch up on fluids at night. You could also try stopping or limiting your fluid intake about 2 hours before bedtime. Also, you want to remember to limit bowel and bladder irritants before you go to bed. Common ones are alcohol, fruit juice, dairy, chocolate, and carbonated beverages. Late night trips to the bathroom not only disrupt your sleep, but they're the leading cause of falls among older adults. So we want to try to reduce them not only for your pelvic health and for your well-being, but also to reduce your risk of falling. Consider increasing your fiber intake. Adding fiber to your diet can be helpful in managing constipation and bowel incontinence. Fiber adds bulk to your stool, which makes it softer and easier to pass. And not getting enough fiber each day can cause constipation. It's estimated that around 90% of Americans do not consume enough fiber each day. The recommended amount is 25 grams a day for women and 35 grams a day for men. Some high fiber foods include fresh or dried fruits like apples, avocados, dried peaches, kiwi, pears, and raspberries. Vegetables like carrots, sweet corn, and sweet potatoes. Beans, legumes, nuts, and seeds. Some examples are black beans, chia seeds, and almonds. And whole grains like bread, brown rice, and popcorn. Some tips for increasing fiber: check your food labels to see how much fiber is in the food you're going to eat. You can also download free apps that'll track your daily fiber intake, and they can tell you how much fiber is in a food you're going to eat. You can use a fiber chart to plan your grocery shopping and your meals, and you can keep your favorite high fiber snacks in an easy to reach place in your fridge or your pantry, so you'll grab those first. Make sure you stay hydrated because your body needs water in order for fiber to work. Make sure you go slow because sudden increases in fiber can cause gas, bloating, or cramping. And make sure you stay consistent. It can take about 2 weeks to notice any changes in your bowel or bladder habits after increasing your fiber intake. Staying active is important for your overall health and well-being, but it's also important for improving your bowel and bladder function and preventing constipation. Physical activity increases your blood flow, which helps with digestion, and regular exercise can help reduce stress, which is known to make symptoms of incontinence worse. While you're at the hospital, we're going to encourage you to spend as much time as possible out of bed so you stay active. We'll encourage you to participate in therapy sessions. This might include grooming, bathing, dressing, toileting, or participating in other daily activities, transferring from your bed to your wheelchair to the toilet and the shower, walking to the bathroom or to the gym for sessions, and participating in group exercise classes. If you're experiencing symptoms of incontinence or you have problems with your pelvic floor, you want to avoid high-impact exercises, and instead you want to do low-impact activities. So you want to avoid running, jumping, certain core exercises like sit-ups, planks, or double leg lifts. These might increase the pressure of your pelvic floor, and they add additional strain to the muscles. This can worsen leakage because the exercises are too strenuous. You want to aim for 20 to 30 minutes of movement most days of the week, and you want to do low-impact activities such as walking, cycling, stretching, yoga or tai chi, gardening or light housework, playing with your pets or your grandchildren, doing chair Zumba or chair yoga. There's free videos online for both of these, and you can also talk to your therapist for safe and personalized exercise programs. Also consider looking into Silver Sneakers, which is a program that you might be eligible for if you have a certain select Medicare plan. They post free videos for Tai Chi, yoga, core workouts, and strength training. Managing your weight and quitting smoking are two other helpful lifestyle management tips that can help with managing symptoms of incontinence and keeping your pelvic floor healthy. Being overweight increases your risk of developing urinary incontinence, and if you already have urinary incontinence, being overweight can make symptoms worse because it adds extra pressure on the bladder. Just losing 10% of your body weight can help with these symptoms and improve bladder control and lead to less leakage. Following a healthy diet and exercise program can help with this. Individuals who smoke and have stress urinary incontinence may experience more leakage than individuals who don't smoke and have urinary stress incontinence. This is because coughing places a frequent downward pressure on the bladder and can lead to more leakage. There's a link between incontinence and stress, anxiety, and depression. And this link goes both ways, with stress impacting incontinence, making it worse or even leading to it, and incontinence causing stress. It's common for people to hold stress in their neck, their shoulders, and their back, but your pelvic floor muscles can also be affected. Even if you don't have an official diagnosis of incontinence, having high levels of stress can cause bladder-related symptoms like urgency and frequency. And stress can also lead to habits that worsen incontinence, such as overeating, especially if you're eating processed or sugary foods, lack of physical activity, poor sleep patterns, and weight gain. Talk with your therapist about stress management techniques that feel comfortable and doable for you, but here's some tips for reducing stress. Deep breathing or mindfulness, gentle yoga or stretching, listening to music, journaling or reading, spending time with your loved ones, prioritizing getting enough sleep, engaging in regular physical activity, and staying hydrated and eating a balanced diet. Remember that small changes can make a big impact on keeping your pelvic floor healthy and managing symptoms of incontinence. Always talk to your healthcare team before making any changes to your diet or exercise routine, but if they say it's safe to do so, remember to stay hydrated, eat a balanced, fiber-rich diet, move your body every day, follow a consistent bathroom schedule, manage your stress levels, and stay consistent. We're here to help, and you don't have to manage incontinence or new lifestyle changes alone. Talk to us about safe options for equipment, exercises, or referrals to pelvic specialists if needed. Here are my references.